we're going to do. I'm Suzanne Wagner, and with me today we have Brenda Earl and Molly Machado from Demas. I want to wave. And on our team is Suzanne, myself, Lauren Peretti, and Shannon Quinn Sheeran. So we're happy to see you all. Lauren, could you do the next slide? So I think you know who we are. We are thrilled to be here. Lauren, Shannon, and I are from Housing Innovations and have been working with as support to Demas and to all of you on all things PATH, providing training and technical assistance and monitoring. And outreach is very near and dear to our hearts at Housing Innovations, and we've been working on it for decades, actually. And I've been so really thrilled to be a part of really growing the outreach with you all and with Demas and bringing you more resources to support you in your work. So that's who we are. Brenda and Molly, do you want to say hello?
Yeah, thanks, Suzanne. Hi, everyone. I'm Brenda Earl with Demas. So I'm currently the state team lead for PATH. And Molly is new with us and she can introduce herself, but she's transitioning into the role. So she has been attending quite a few of the different outreach meetings and PATH meetings. So you should see her name popping up in your emails. But I just wanted to take a quick second and thank you all for logging in with us today. This training kind of came out of the last year or two of feedback from the monitoring visits, and just with COVID, so much staff turnover, so much staff change, you know, people getting COVID and being out for 2, 3, 4 weeks and kind of having those gaps in services and gaps in staffing and all hands on deck. You've got all kinds of different staffing, your agencies jumping in to help so that our clients kind of have seamless services, which we can't even say how much we appreciate all of that hard work over the last couple of years. But we thought it would be helpful to kind of record this training so that as new staff come on, they can watch this and learn a little bit about the thousands of data systems that you have to use for PATH, right? And HMIS, and then you have DDAP, and then you have PDX, and you have all of the SAMHSA stuff, all of the Connecticut stuff, all of the Demas stuff. So we thought, let's kind of put it in a webinar, kind of a one-stop shop. So as you have staff change, you can have them watch this webinar and of course, reach out to us with any questions. I will just quickly note, if you're a subcontractor of PATH on this call, I'm really glad that you were able to jump on, but just understand some things may only pertain to the Demas contracted PATH provider. So if some things don't make sense, if you think, oh, I don't use that system, feel free to pop on and ask us. It may be that your the contracted agency is doing the work directly with us. So just to kind of clear that up, sometimes that gets a little bit confusing. So I will stop there. Molly, do you want to introduce yourself?
Hi, everybody. My name's Molly. I'm new at Demas, but I'm not new to homeless services. I worked in the Greater Hartford and Central CANs for about 5 years, back when CANs were getting up and started. So I'm excited to be back and to see some familiar faces and to meet some new folks, and I'm looking forward to this training.
Thanks, Brenda and Molly. As I said, we're thrilled to be here. We know you are all really busy. We know you are serving people who have lots of things going on. You are supervising probably more staff than you want to, or maybe just enough. But our goals are to provide you with information that's relevant, that you can use, that clears up questions and confusion. And as Brenda said, it is recorded and you're free to, it will be posted so you can access it any time. And even though this is targeted to supervisors, you know, as I think about the content, I think it's really good content for line staff to have and understand, right? And you may use this in training, use the slides, feel free in training with your new staff to orient them to, as Brenda mentioned, the complex alphabet soup of reporting and funding and everything else. And we'll have a lot of discussion today about all the acronyms. We love to see your faces, but we know not everybody's camera ready all the time. So turn your cameras on as much as you are comfortable doing. It looks like everybody's done this about put your name the way you want to be addressed. The chat slides are already up. Do not wait for us to ask if you have a comment or a question, or you want to share something you're doing. Put your hand up, speak out, put something in the chat box. We do have in today's session a few points where we're asking, your thoughts and comments. We have a couple of breakouts, but don't wait until we pause. We really want this to be a session that works for you and answers the questions you have. And also we do want and hope you guys will make new connections with each other and share some of the things that you're finding work in your teams. We ready? Everybody knows we're recorded. Oh, and there are a lot of slides, and even though I know many of you probably expect Lauren and I to be reading the slides, we don't do that anymore. We're not going to read every word on the slides. There's a lot in there, and due to time, because we are honoring your time, this is a 2-hour session, we'll be skipping through some things quickly, but you'll have it for reference. So we don't expect to really cover everything. Okay, so what our agenda for the session is to kind of get everybody on the same page of outreach, the visions, values, and goals in the state of Connecticut. One thing, Housing Innovations works in lots of different states and with lots of different communities. One thing that is really beautiful in Connecticut is the level of statewide coordination, and that there really are for the whole state, for both the PATH programs as well as other outreach programs, recommended standards around vision, values, and goals, a shared approach to the work. We'll go over kind of the key roles of the supervisor. It says key supervisory responsibilities. There's a lot of slides. Again, reinforcing that it is a really important role. We'll talk about the money, the data, the reporting, all those different systems. There's a lot of links in the slides, and those directly take you to places that will either give you more information or get you to the reporting mechanism. Talk about consumer surveys, the development of outreach plans, which is a requirement to have a plan for outreach in your CAN. We'll talk about monitoring, which I think everyone gets monitored in PATH. It's been remote since COVID started. We'll talk a little bit about what to expect, what that's like if you haven't been through it. And then we'll wrap it up, and we have a lot of extra slides there. So there already are links on this first slide I don't know how we have a link to the recording already. Is that maybe left over from?
That's for the session 1. So those are the links to what we covered in
Thank you.
the first session. Yeah.
Right. Forgot that. Sorry about that. We did already, and hopefully some of you were there, have an orientation, overall PATH orientation webinar that we did about, I want to say 6 weeks ago now, 8 weeks ago, maybe. And those slides and the recording link are there. Okay, next slide. I think I'm going to do groups of 2 because I see 8 people besides us and Demas. Okay, so we're just going to give you a chance to talk. Already I've been talking too much, and we definitely want you to participate and engage and maybe meet some new people, maybe not. We're going to break you out into just groups of 2 and to talk with each other about who you are, one thing you love about your job, and one thing that's been a silver lining during the pandemic. I know the pandemic has been so difficult for all of us in so many ways. And certainly really hard for your staff and outreach and the people who have to live outside or unsheltered. But, the funny thing is there have been silver linings. I think every time we ask this question, sometimes it takes a while to dig for that. But we'd like you to share that with each other. So thank you. Shannon already put the questions in the chat box. And I'm going to welcome back. They're just going to wait another few seconds for everybody to return. I'm not seeing. Yeah, still have 2 more seconds in the breakout rooms. Okay. I think everybody's back. Welcome back. I see some smiles. So hopefully people had good chats, kind of reconnecting to, what you love, why you're doing this hard work, and something that's been a positive for you? I know we bring a lot to every day when we start our jobs that we bring with us. So hopefully this clears the brain a little bit, maybe made a new connection. We're going to break you up again. So excuse me, we'll try to mix it up a little bit. Anybody want to share anything before we move on? We really do love to hear you talk. No? All right, we'll warm you up. All right, next slide, Lauren, please. Okay, so what is really outreach about in Connecticut? And again, really nice to have a set of values and goals that are statewide. So could you go to the next slide? There are a set of standards that have been recently drafted. Hopefully all of you have heard about that before because there's been meetings about it, an opportunity for input. Right now, those standards are recommended for folks. They really give direction to how you do the work, staff's roles, approaches to engaging with clients around housing planning. Right now they're recommended. There's a link there, and Shannon, I think, just popped them in the chat as well, so you can access them now. Anticipated that they will become contractual obligations for 2024. I think the link is broken, Will says. Okay, so we'll have to.
I'll work on that.
Yeah, in the link in the PowerPoint or the link that Shannon just put in the chat box, which one isn't working? In the chat. Okay. All right. Shannon will work on that. But again, they're recommended. I think people have found them very helpful. It gives concrete direction to what is really very complicated work with people. People present a lot of needs, and I think also helps in staff training to give them an orientation to the work. And the standards are organized by sections for supervisors, sections for line staff, and sections for administrators. So hopefully, I think it's a very digestible document, but you can also hone in on the things you need to know. Next slide. And this outreach vision and goals is actually right up at the front of the standards. And the vision of outreach in Connecticut is to help people who are unsheltered get into a permanent, sustainable housing situation. And that can look lots of different ways, but really helping to end their situation of being unsheltered. And while shelter or a housing stabilization bed might be an interim step, ultimately the goal is to help people connect to a permanent resource, including also, in addition to a safe housing, getting people income, supports, finding folks, working to coordinate. I think, one really big step in coordination that was taking place years ago already was to really organize outreach by CAN, Coordinated Access Network, so that, there really hopefully are not too many gaps, and to help with that, trying to use resources strategically to help people be ready to meet whatever tenancy obligations they have in their new housing. Some folks may have had their own place before. Some folks may never have had their own place. Some folks might have had their own apartment many years ago, but we need to help people be ready to meet those, whatever the obligations are in the setting that they're in, and then connect people to services post-housing through a warm handoff and the aftercare process. And we talked about that in the intro session a lot. I don't know that we'll pick up on it very much today, but I think you all know that the warm handoff is really a best practice, and reinforcing that best practice. Shannon has just popped up a new link. Next slide, Lauren. So some of the values that go along with these goals is really thinking about housing first. How can we get people into housing as quickly as possible, remove barriers to that access, not require courses of treatment or other things that don't relate to the housing process, so that we can help move people out of unsheltered homelessness as quickly as possible, which relates to the second one, is having a sense of urgency about this. Unfortunately, some people have lived outside for a long time, and it can lose that feeling of urgency. But I think we all agree that, people should, have decent housing, and that we want to really create that urgency in our teams and with our clients to get people out of homelessness as quickly as possible through a partnership model where we respect the client's perspective, their motivations, their choices, their stuff, which is really important, their property, that the foundation of this work is a relationship. That is not changed. We can have standards that tell you what to do, but if you don't have a connection with a person, it's really hard to do this work. And so there's a real value on engagement and connection, using a harm reduction approach, helping people be safe, stay safe. And that includes, physical safety, emotional safety. That doesn't only apply to drugs and alcohol. I think we think about harm reduction a lot, but it might be being safe from assault, or, other things, or reducing harm by helping people not freeze to death like you've done all winter. Spring may eventually come. Getting people into housing through an equal access process, having a relationships that are transparent with partners. So you all work with your coordinated access networks. That's your main partner. And we'll talk a little bit more about that. But for there to be an open process, how do people get on the list? How do people get prioritized for access? How do people get connected to housing resources? And then, of course, being consistent, not only with the clients, but with our partners and with everybody else we're working with. Next slide. Going to speed through these already. A lot of these are kind of going deeper on what we said before, but really being an ally with the client, walking alongside of them, helping them find their housing, being part of a network. Take self-care. That one I'll call out. It is hard work. It is, we have successes with folks who get housing, and that's great. We have lots of times where we're struggling and where it feels like it's hard to get things moving, and having a culture of self-care for staff, for supervisors, very, very important. Meeting people where they are, being creative problem solver, committing to data. And we're going to talk more about data because data is really important. I think one other thing that is really different about Connecticut from a lot of other places is the commitment to data, to looking at data, to using data, to think about what's working, how are clients moving through the system, is the effective in services and what isn't. And then also having very regular planning, and we'll talk more about that later. Next slide, please, Lauren. Okay, so there's in the recommended standards, you'll see these outcomes, and you guys are tracking things, really looking at people who are moving to permanent housing, looking how quickly people move into permanent housing from the time of outreach, enrollment to the move-in process. Next slide. And then looking at outcomes around increased income. You already are tracking that, whether people are getting cash income, whether they're getting income from SSI, and how that's changing from when they begin with you to end. And then doing data entry on clients within 72 hours of encounter. So in addition, in those standards that we just shared with you, there are additional internal performance standards that might be, some of them are more process standards, but those are the big things looking at, really, are people moving into housing? Are they moving quickly? Are we getting them some resources because having no money is impossible? And then are we getting that data in the system? Okay, so now you've been quiet because I've been yakking. Just to talk about what are you doing in your programs to help you succeed on these outcomes, quickly moving people into housing, getting them into permanent situations, getting data into HMIS, and connecting people to resources. What are you guys using? What are you finding is working? What are your best practices? What do you want to maybe brag about? Although some of you are probably not braggers. What do you want to share with your colleagues so they can learn from you?
Or also, Suzanne, if I could also put out there, what are your barriers? Like, especially around getting that data in 72 hours in multiple data systems. Like, what are your barriers? What are your struggles? Please feel free to unmute and chat with us.
Well, I have to say, for Columbus House, our PATH program in Middletown, what has really helped us is having quality staff. none of these things that you spoke about happen without the quality of staff that could actually do these jobs, do the jobs that they're asked to do, and document their efforts in this. So we're very fortunate this time that we've got two awesome outreach employees that do a great job in identifying clients who are homeless and are unsheltered, getting them connected to services, and to and document ready to be presented to the team to be matched to rapid rehousing. So nothing starts without finding and hiring and training our staff. So that's what's worked for us at Middletown and Columbus.
Thank you,
Andrew,
Andrew.
can you
That's
tell us-
absolutely.
Yeah, can you tell us how you got those awesome staff? Is there some hidden website you can share with everybody else?
Will is the one. Will Carpenter is my Middlesex Emergency Program Manager. He was able to hire Olivia and Kelly, and they're just super awesome. And again, it's kind of the luck of the draw. It's a blessing that Will was able to find them and train them. So, but that's where it starts. It starts with hiring the good quality staff.
Will, tell us your secret.
No secrets, just had to kiss a lot of frogs along the way. We've had many people in this position, but it's finally working out right now. In Olivia's case, we took a chance on her. She just graduated college, I think last May. This is her first real actual job outside of college. And she's done remarkably. For hiring, yeah, there's no real secret or panacea there. It's just lucky, I guess. For a quick exit to permanent housing, I think utilizing rapid exit has been really helpful for us, especially during the cold weather season towards the end for our outreach programs.
How did you use the rapid exit, Will? How did you use that?
Just shared housing models. I think getting clients to agree to roommates. I think we successfully housed, I want to say 5 people towards the end of the season. We had 3 people together and 2 people together in units, and then they all had some sort of income, whether it's SSI or a job, and then just rapidly exit them. So security deposit, first month's rent, and then push them out on their own. Not push them out, but gently nudge them into the backup.
The warm handoff into the afterworld
Exactly.
there.
Yep.
Great. And that rapid exit, it's a little different in every can, but that's money to help with those upfront costs with a housing that can really be a barrier. And having people have roommates, which is really, if people want to live together, it's a really great way for people with limited resources to make it work. And I think I just want to echo the thing about the staff that, it is a relationship-based work, right? And people need to really love outreach and really want to connect and like the people that we're serving. And so thank you for, bringing that piece up. And that's why your roles are so important when Lauren's going to pick up, because a lot of being a supervisor is helping to grow those staff and support them to be as good as they can be. So it's a great point. Other things people have found successful or have been helpful in getting people into housing, getting people to income. D. Fish, I don't know what your first name is. Do you want to
David.
speak? You're unmuted.
It's David.
David,
Yeah.
okay. David.
So and we just picked up the Northeast can. So it's the Eastern can, but it's separated into Southeast and Northeast. And we just picked up the bath contract in the Northeast. And the biggest thing I notice is how we identify homeless here in New London County. The city of Norwich and the community here with our care team meetings. It's just such a great collaboration. We have the ambulance crew on there. We have the police on there. We have the soup kitchen on there. The soup kitchen's vital in this area for information. That's where the people go. We also have a soup kitchen in New London where the homeless hospitality, we have a subcontractor down there. And really noticing moving up into the Windham County area. Thankfully, we had 2 amazing staff who were hired for the Emergency Solutions Grant, who broke ground up there for us before our path worker went up there. But with no soup kitchen in the area, it's really difficult to identify people. There are some agencies up there that help us, but we actually had a meeting on Friday at a local diner in their area, and I ran into a friend I hadn't seen in 35 years. And he's on an ambulance crew, and he was very helpful in identifying some of those people because they utilize that service. So
Yes.
just the collaboration in this area, and we're going to try and build that in the Windham County, Northeast Canton area. But just to give big props to those people at the soup kitchen and human services in Norwich and all those things. It's just without a whole collaboration. And like they said, some people that are great workers. I think the biggest thing is we could train anybody, but they have to care. It has to be in their heart. They have to want to do the work and they want to help the people. So that's the biggest thing, is the collaboration in this area to help us identify.
Yep. And David, you're with Reliance House, is that correct?
Correct.
Okay, just making sure everybody, because I don't think everybody knows each other, but I don't know. I don't know everybody. So I'm glad to learn all your different organizations on this. And I think that such another really important point, because how do we find people is through their use of services and connecting with places that people go, and then we can find them too, because we know they go to the soup kitchen, for example, and that's where we'll be able to find this person. Brenda.
Yes, thanks. No, David, you just reminded me of a quick announcement I should make. Actually, shout out to Reliance Health and CHR. So just to let you guys know, we have kind of dwindled down to 5 PATH providers now statewide. We did have 2 of our providers. And again, when I say that, I mean the DEMAS contracted providers. I know you have subcontract providers, they're still intact. So Reliance Health is now taking over the whole eastern side of Connecticut, as David said, kind of that north and south. And CHR now is going to cover Greater Hartford and the Central Connecticut can. So Friendship Service Center and Perception Programs both decided to transition away from PATH. They have other priorities within their agency. So we were lucky to be able to kind of absorb those into providers that were already working in those areas. So it's the mighty 5. So I just wanted to put that out there. So David, Jen, thank you. Thank your agencies for jumping in, and we should hopefully have no real gap in services. So that's fantastic.
Great. I think we're gonna move on, but if just want to give a chance if anybody else wants to share anything. I'll pause for a minute before I hand it over to Lauren. I'm not seeing anybody on mute, and I'm not seeing anything in the chat. So thank you. Thank you for sharing those things. I think it always enriches the conversation so much to hear what you're doing in your own teams. I'm going to pass it over to Lauren now.
Hey, everybody. So good to see you all on Zoom this morning. So you guys talked a lot. Of course you did, because you're great people and great supervisors, giving props to your teams. And we know that your staff are a super important part of delivering really good quality services to folks who are living unsheltered. But also you guys as supervisors, you know, we rely on you to make it happen, right? So your role as supervisors are key. Your teams absolutely cannot do the great work that they are doing without the great supervisory support that they get from you. So we wanted to just spend a few minutes here going over what some of the key responsibilities are for a PATH supervisor. And I know a lot of you on this webinar this morning are old hats at this. So bear with us as we go through, because this really is intended for folks that may be very new in their position. So so the first, critical, probably the most important job that you're doing as a supervisor in the PATH program is to help your teams move people off of the streets and into permanent housing. And the key way, the main way that you're going to do that is by ensuring that every person that's enrolled in your PATH program, for whom some sort of assisted housing is going to be their pathway out of homelessness, and that's most of the folks that are living on the street, making sure that all of those folks get on the by name list. We do occasionally still, when we go out and monitor, see folks that have been enrolled in PATH for a while that for whatever reason have sort of fallen through the cracks and have dropped off of the by name list. And I think that sometimes happens. We saw a case recently where maybe somebody was, self-resolved temporarily, and so was moved to inactive status and then resurfaced, and just it didn't, the administrative piece of it didn't happen. So certainly knowing everybody that's enrolled in the PATH program, looking regularly at that list of all the folks in your HMIS that are enrolled, and knowing for each person what is their pathway out, and if it is their by name list, making sure that they are in fact on and have active status on the by name list. And then obviously coordinating closely with your case manager and your team, with your CAN, your coordinated access network, and your team, to really understand, who's doing what by when, to get that person document ready, and move through that CAN system as quickly as possible. And a lot of times when we see you guys doing this, when we come out and monitor, really advocating for people at the CAN to help move them through as quickly as possible. So regardless of whether or not somebody's pathway out of homelessness is going to be through the by name list and some kind of assisted housing or some other pathway, right? Sometimes folks have some income and they're going to rent housing on their own, share housing, like you guys were talking about earlier. But really for everyone on your PATH caseload, you want to be doing some kind of regular rhythm of case reviews with your team, so that every single person who's enrolled, you do a case review. And a lot of times that happens in the team meeting rather than in one-on-one supervision, where you're going through the entire caseload. How often is really going to depend upon how many people you have and how you're staffed, but you probably want to do a case review for every person, about once a month. And really looking, when you do that, at the service plan, right? So I think sometimes we think about service plans as a documentation requirement, right? It's a piece of paper that the case managers are responsible for updating every 6 months and putting in the client chart. And we want to sort of move away from that way of thinking about the service plan and really see the service plan as an active document that we use to guide the work, right? Because the service plan really at its core is an agreement between your staff and the people that you serve about what each party is going to do, what the client's going to do, what the staff is going to do to get them out of homelessness and into housing. And so when you're doing those case reviews, you really want to look with your team at, what are the action steps? What were the target dates for those action steps? What's happened? If there are barriers, roadblocks to things happening, how you can help support staff to resolve those roadblocks. So I think people know this, but whenever we roll out something new, it's always good to mention it a few times. So we did recently work with DEMIS to update the template that DEMIS requires for you to use for the assessment and service plan for the PATH project. And so that new template, it's got some additional things. It's still really short. We didn't make it long, but it's got a few additional things on it that make it more aligned with the critical time intervention model. And the link for that new template is here. So if you haven't already, please start using that new template with your participants. And next year, probably when we monitor, we'll start looking for that. All right. Another really super important thing that you guys do as supervisors is, working with your team to make sure as much as possible that you're keeping everybody safe, right? So each of your agencies, one of the monitoring standards, one of DEMIS requirements is that each agency has a written safety protocol that's specific to the PATH program, right? That addresses things like, in what circumstances is it okay for outreach workers to do outreach alone? In what circumstances is it required that they do outreach with someone else? How are you going to make sure that you as a supervisor know where your team is when they're out in the field, what their field schedule is? How does that plan get updated regularly? So that you always know day to day where folks are, and that you've got some predictable schedule when your team is in the field, that they are going to check in with someone back in the office so that you know that they're okay, even if they're out in the field for the whole day. And then also making sure that there's always a supervisor when you've got folks that are out in the field working, that there's always a supervisor that is on call and responsible for being available if somebody has some sort of safety concern or other crisis out in the field. And so you want to make sure that obviously you've got that written protocol and that your staff know what the protocol is and that they're actually following the protocol. We also want to make sure we can't just assume, people are coming into work as an outreach worker from all different sorts of previous work experiences. They may not have had experience, working with folks who are experiencing homeless before and thinking about what all the COVID safety protocols are. So you want to make sure that they're oriented to that. We covered that in the onboarding training. So that's a resource that you can use. And there's some other resources later on in the slides that will point you to. You want to make sure that as part of keeping everyone safe, that you are familiar with and your staff are familiar with clients' history. We always like to say that our clients are way more likely to be victims of trauma than they are to be perpetrators of violence. So we are certainly not saying that all of the clients are dangerous. But we definitely do work with some folks who have a history of violence. And so we want to be mindful of that, understand what that history is, understand whether it was a one-time incident or a pattern, understand what the triggers are, and have a plan for when we're working with those folks, how our teams are going to work with them safely, as well as understanding, all sorts of other things about our clients, right? What do they like? What are their strengths? Where do they like to hang out, et cetera. Suzanne talked a little bit earlier about harm reduction. We can't assume that staff coming into this work understand the model. So we want to make sure that we're orienting them to that. There is a resource here on this slide that staff can use to help folks in a really non-judgmental, matter-of-fact way identify what the risks are that they are facing, whether it's like Suzanne was said, freezing to death or overdosing from heroin, helping people to identify what those risks are and make plans for themselves, make decisions for themselves about what risks they're willing to tolerate and what steps they're going to take to reduce those risks. We want to make sure that we're building partnerships with our local police, right? We don't want to just only, first time you ever talk to leadership at your local police department is when you've had some sort of terrible thing happen. So really being proactive about building those partnerships. And you guys talked already, I think many of you are already doing this. And then always when we have critical incidents that occur, not just documenting them, right, filling out the paperwork that's required, but also really using those critical incidents as an opportunity to learn. So when something happens, really sitting down with the team to debrief, talk about what went well, talk about what we want to do differently next time, talk about any changes we need to make in policies or protocols. The labor market is really rough right now. So you guys are, experiencing a lot of turnover. And so you are consistently having to onboard new folks. And that's part of why we decided to do this series with you. So you want to make sure, I think most of your agencies probably have an agency-wide onboarding plan that all staff get, right? That's going to focus on things that are agency-wide, right? Like using the agency vehicles and how to do your timesheets and all that kind of stuff. But you really need to have an onboarding plan that's specific to the PATH program when new staff come on. So that this slide goes through what are some of the things you want to have in such an onboarding plan. So a key one, Suzanne talked about this, the warm handoffs, right? The relationship is the core of this work, and it goes a long way when someone who already knows the client accompanies the new worker out in the field and says, hey, Joe, this is my good friend, Sue. I want to introduce you. Sue is great. She's going to take great care of you, and really do that relationship building piece, because you're then offering some of your relationship, you're lending some of your relationship that you've already established to the new worker, and it makes it much easier for them then to connect with that participant. Same thing, obviously, you want to introduce folks to your partners. You want to make sure that all the safety stuff that we just talked about, that they're familiar with your safety protocols, and that they get some training on de-escalation. And we've got some resources on that later in the slides. You want to make sure that they understand the parts of the new outreach standards that are relevant to them. and that they are understand and are on board with the values and the goals and the outcomes that Suzanne just went through. And of course, you want to make sure that they're familiar with how we do outreach in the state of Connecticut, which may be different than how they've done services in other places, right? And so that's, all the stuff about assertive engagement and housing focused case management and housing first. And those service models, we hope that the first session that we did for the outreach workers, the onboarding session, will be helpful to you guys and can become a part of your onboarding plan as you are bringing new staff on. Want to make sure that folks are really familiar with what rights our participants have in the program. So that's things like making sure that every client knows that their right to grieve and how to use your grievance policy, making sure staff are clear about confidentiality and how to protect that, and making sure staff are clear about clients' right to self-determination, right? We're not making decisions for anyone. We're just trying to help people make the decisions that are best for them. So you'll want to make sure folks are oriented to your outreach plan. And that includes, hopefully, someone at your agency being familiar with the actual places where outreach happens, the soup kitchen, the library, the town square, and going out with the outreach worker initially to show them the lay of the land and introduce them to the folks out on the street that you regularly encounter. So want to make sure that folks get access to HMIS as quickly as possible and trained as quickly as possible. And if there are any other administrative responsibilities that you have assigned to them, maybe they're responsible for DDAP upload, for example, that all that's reviewed. That you talk about the documentation requirements for the program, and there is on the CT Boss website, it's linked somewhere in the slides, the PATH participant chart guidance. So there's a document that shows for all of your PATH participants what things you need to have in their chart. So that's a good tool for onboarding. And then, of course, having a plan for ongoing training, right? People can't integrate all of the information in the first week or month that they are on the team. And so making sure that you've got a plan to roll out training as you go, understand what their professional development goals and be working to help them move towards achieving the things that they want in their career. So I know I've been a supervisor for a long time, and I know as a supervisor, this is a thing that I have been guilty of in my career. I think, you guys are super, super busy, and it can often be tempting to say, well, I have an open door policy. So if they need me, they know where to find me. I don't necessarily have to schedule. Supervision. If I'm too busy, that's a thing that I can cancel. And I feel like it's usually a mistake to do that when people don't always come to you when they need you. And having that scheduled time carved out to really sit down with staff and go over and see what's working can really avoid a lot of learning at the 11th hour about little piles of poop that it then takes twice as much time to clean up later. So really encourage, the requirement is that all staff get a minimum of one-on-one supervision every other week. And that if you've got more than one outreach worker, that you do some sort of regular team meeting every other week, or a huddle, which is really often used by larger teams on a daily basis. For example, first thing in the morning, spend 15 minutes, 10 minutes with the team, just really going through what are the tasks for today, right? What are people going to prioritize? Who's going to see whom? What are the most important things that we're going to get done together today? And then really, the workers are so busy, right? There's so many things that they could be doing every day. And particularly when people are new, it can be very hard and overwhelming to filter out all the noise and really focus on what are the most important tasks that need to happen in order to get someone document ready so that they can get housed. And so that is a critical part of supervision, is really sitting down and saying, okay, the disability verification, what are we going to do, in the next 2 weeks to make sure that this person has the disability verification, for example. I'm not going to go through everything here, just touch on a couple quick things. You know, your job as a supervisor is to help people feel effective at their jobs, right? People stay in their jobs when they feel like they're doing a good job and they're accomplishing things. And these are just some things we need to do to help make sure that staff are able to be effective so that they stay on our teams. So, you know, certainly we'll talk about this a little bit in a minute. This is hard work, and we need to just be checking in with staff regularly. Sometimes the work is even traumatic, right? So we need to be checking in with staff regularly to just make sure that they're okay, right? And that we're providing support and guidance when they're having a particularly rough week or a particularly bad day. We also want to make sure as a supervisor, right, it's our responsibility to make sure that we're giving staff the resources that they need, right? That's a big reason sometimes that people don't want to stay in their jobs. It's because they feel like they don't have the resources they need to be effective at their job. So that includes things like making sure that our IT systems are functioning well, making sure that we, you know, provide people with the training that they need, and making sure that we've got some way that we're providing clinical consultation, right? Staff are out there in the field, you know, working with folks that have humongous clinical challenges, and having a clinician available to them to touch base and help them figure out a little bit what they're seeing and how best to intervene is really critical. And, you know, sometimes these things may not always be readily available at your agency. And so your job as the supervisor is to really identify for the senior staff at your agency if there are things that your team need that you're not currently able to provide, and really advocating to make those things, you know, to understand how important that is and to make those things happen. So, you know, we like to say self-care isn't selfish, right? It's rough, this work, and it's so important that you guys as supervisors are really modeling good self-care. You know, it's the time when you are most stressed out and have 10 million things to do and you're pulling your hair out. That's really the most important time to take a break, and having your staff see you do that, right? See you say, hey, let's take a breather for 10 minutes and go out on a walk and talk about something other than work, really gives them permission to take that time to clear their heads and take a break themselves. We certainly do not want to idolize workaholism, right? So as supervisors, we want to take our vacation days. We want to go home at the end of the day and not stay in the office until all hours of the night. And that, you know, our team seeing us do that, again, gives them permission to do the same. And then, of course, we all want to practice all of the healthy lifestyle things that are on this slide that I won't go through. There are some slides. Andrea White on our team at one point early in the pandemic had done a little presentation just on self-care for outreach workers. So that presentation is here. The slides related to self-care are not right at the front of that slide deck. So you need to like sort of move through the slide deck to get to the slides that are specifically on self-care. We are also, as supervisors, one of our key responsibilities is to build a culture on our teams that really is continuously asking, how can we make our services today just a little bit better than they were yesterday, right? No matter how awesome your services are, and your services are awesome, I get to see them. I'm lucky that I get to come out and witness that when I monitor your programs. But no matter how great our services are, they can always be a little bit better, right? And so building that continuous, quality improvement culture is really a key role of the supervisor. There's a tool that we have developed that I think some of you are using that we just wanted to point you to. It's a tool that you can use with your teams to set housing targets and then to monitor your progress towards achieving those housing targets, right? And so the idea is that we did this when we worked with outreach teams in New York, right? Every quarter, you can sit down with your team and say, okay, you know, next quarter, we want to try to house 3 people, right? And the 3 people that we think we're going to target to get housed next quarter are Joe, Sue, and Sally. And then, you know, if you want to house 3, we know in outreach, and we learned this in New York, right, that things happen. So, Joe, Sue, and Sally may end up disappearing, going to jail, or in the hospital. So if you want to house 3 people in a quarter, you probably actually need to target 6 people, right? That you're going to be able to house in that quarter in order to get to the 3. Because unexpected stuff is going to happen. And then what that enables your team to do is to say, okay, yeah, on any given day, there's 6 million things, 6 million ways that I may spend my time. But what I'm going to choose to do today is to focus on getting Joe to that, see that apartment, even if it means I have to really drive around quite a bit to find Joe, or getting Sally to the clinician to get her disability verification. And those are the 2 most important things that I have to do today. So really having those targets and knowing, right, this is what we're committed to make happen this month can help the team to focus on the things that are most important. And I love the graphic on this slide because it really shows that, the things that matter and the things that you can control, right? So what matters is getting people housed, right? And what you can control is limited. There are lots of things that you can't control. You can't control the housing market. You can't control whether or not Joe gets arrested, right? But where you want to focus your time is right in that intersection on what are the most important tasks to get somebody housed and what are the things that we can actually control. And then, whenever we're doing any sort of continuous quality improvement work, it really has to be a staff-driven exercise, right? So it's not about you as a manager sitting in your office and coming up with these lofty goals. It's about engaging the team in a conversation about what is realistic for you guys to accomplish together. And then as things come up and you're not able, roadblocks come up, how are you as a team going to support each other and help each other to overcome those barriers? And then, of course, we want to celebrate every single success. The successes can be very slow and small in outreach. So even as something as small as, congratulations, Joe made eye contact for the first time, right? That's huge for somebody that, is paranoid and may have been out on the street for years without building a relation with someone. So really helping your team to feel good about those successes, even when they are very small. We want to make sure that we involve our clients also in this process for always making our services a little bit better today than they were yesterday. And there are a number of ways that we can do that. Every year, we're going to talk a little bit about consumer surveys later, but every year we ask for input from consumers on those consumer surveys. So we want to look at what they tell us and see if there's anything actionable that we can change about our programs based upon that feedback. Sometimes, it's not clear. Somebody might have said, the communication wasn't as good as I wanted it to be, but you don't really know what that means or how to fix it. And so another thing that can be important is doing some follow-up to ask people, what did you mean by that? And, how can we make it better? We talked a little bit about learning from critical incidents already. Another opportunity to make your program stronger is anytime you have a grievance, right? Looking at, is there anything that you learned from that grievance that you're going to do differently, not just for that person, but for everyone in the program. And then certainly making sure that you've got people with lived experience of homelessness who are engaged as volunteers. I know a lot of you are hiring folks with lived experience of homelessness, which is great. And on your board of directors, and anyone that's got HUD COC funding, the requirement is that you have at least one person, and it's always better to have more than one person. One is a lonely number on your board of directors. So as supervisors, we've got to make sure that our outreach plans are updated at least once monthly. We're going to talk more about that in a minute. We want to make sure that staff understand why documentation is important, right? So if you say to somebody, you've got to do a case note every time you see a client because that's what the agency rule is, right? That's a lot less compelling. You know, people do this work not for the money, but because they care about the clients, right? So whenever you can explain to staff why documentation is important for the clients, that's going to be a much more compelling message. So rather than saying you have to do it because it's a rule, say, you know, when we write case notes, that's a way for us to remember what it is we committed to do for the client so that we can be sure that we're following through on the commitments we made to the client. We want to make sure as supervisors that we're looking at our data regularly. You know, we do sometimes still see, although definitely less and less when we come in and monitor, you know, you've got somebody on your participant list that's been, you know, enrolled in PATH for the last 6 years. And it's just that they were never exited when they should have been exited. They really weren't enrolled for 6 years. You want to make sure that you're looking at that regularly, that you're looking at your PATH annual report regularly. You probably want to do that at least quarterly so that it's not like a surprise at the end. You're not scrambling at the end to try to clean that up before it's due. And then you all have in your intended use plans commitments that you're responsible for around the number of people that you're going to contact in the year and the number of people that you're going to enroll during the year. And you want to make sure that you're looking at that, you know, monthly or at least quarterly to make sure that you're on track to meet those commitments. Some of you have subcontractors. And so if you are a prime that has subcontractors, you are also responsible for overseeing the work of your subcontractors. And you probably want to check in, you know, at least quarterly with your subcontractors as well to make sure that they are meeting their annual service level commitments. All right. So that was a lot of me talking. Somebody has their hand up.
Yeah, there's a hand up, Lauren, and we
yeah.
got to move.
Yeah.
Okay.
Oh, if we don't have time, it's fine.
No, we have time for you. Go.
Oh. I don't know if it's appropriate for here, but I wanted to ask a quick question about the contacts.
Mm-hmm.
So I know we've gone back and forth about this. So we don't track our contacts in HMIS. And I feel like I never get a clear answer about whether that's required and how people do that. If you do it in HMIS without having like a release of information from that client already.
So I think you can enter clients anonymously in HMIS without a release of information. And I know that some agencies are, like I believe Columbus House is tracking their contacts in HMIS. And I think the goal is that everyone should be using HMIS to track their contacts for a couple of reasons, because then it's accurate on your annual report because you generate your annual report out of HMIS. And also because it can help in demonstrating eligibility for people for housing, right? Because you're showing that you've had contact with somebody out on the streets. So, so Brenda, you have your hand up. So let me let you.
Yeah, I'll just jump in and if
Yeah.
Columbus House wants to explain how they put their contacts into HMIS, that might be helpful. But just quickly, Jen, just so you know, there's currently no build out in HMIS to truly capture contacts. And even though you guys have to keep track of your contacts, most providers do it separately, maybe in a spreadsheet or some other database, an EHR, or something internally. Ideally, we're trying to work with Nutmeg to do something so that we can capture a true contact in HMIS that would pull over into a PATH enrollment. That is not something that is functional or I think even built. But just to answer around the pulling of the contacts into your PATH annual report, it does not pull from HMIS into PDX for your annual report. So even if you do go in and put, I think, and I don't have all the questions correct, but I think you can start to put the data for the client in, but you're clicking no for PATH enrollment, which that should count as a contact, right? That's somebody you've come in contact with, but they're not enrolled in PATH. That doesn't roll over into PDX to count them as a contact for your annual report. So I don't know if I confused you more, but no, it's not something that currently is a functional thing in HMIS. Unless Columbus House, you have something I don't know, which I would love to hear.
Yeah, I would love to hear it too, because so if it's if we're entering something in HMIS, how are we putting that in the APR? Like, how are we then putting that into PDX? Do you know what I mean? Like, is
For
there
the
a
contact,
report to run? Yeah, like right now, we literally just have pieces of paper and
That's
I'm
what-
counting pieces of paper. So if we
that's what
do
most
move-
providers do.
Okay, so if we do move to doing something from HMIS, I just want to make sure I have a way to still count. You know what I mean?
If we actually get that into HMIS, it'll be rolled out, you'll be trained, we'll do examples of reports. That would be a full rollout. But currently that's not what's happening. But again, I would ask Columbus House, if there's something.
Will
built
was
within-
nodding his head when
Who
you
is?
said, when you said said something about your paper. Will, do you want to say something about that?
Yeah, we collect the outreach forms, first contact forms on paper. I'm not
Yeah.
sure how Elizabeth, your team does, probably similar.
Similar, same.
Thing, yeah.
So
Yep.
I thought anyway, we can talk about this offline, but I thought Radhika had a way that she was getting those then into the PAR.
And I just don't know how she does that, so I can't
Yeah.
speak on how
Yeah,
she's.
What's
Anyway.
the PAR?
the Path Annual Report.
Oh, she's doing it manually.
Oh, okay. Okay. So
As
there's a
far
way
as I
for them,
know, everybody's doing it manually for contacts. There's nothing in HMIS that accurately tracks contacts at this time.
so they're able then to adjust their PAR manually with. the
Oh, yes.
contract? Okay, so that's
Yes.
maybe that's the difference of what Radhika's doing than what everyone else is doing. Is it then making that adjustment manually based on the paper forms?
Everybody
we're-
does things manually, just so you
Yeah.
know. You can download it from HMIS or do everything manually in PDX.
Okay, so right now there's not the requirement of doing that in HMIS. I agree. I would love to do it in HMIS. I just don't know how to.
No,
I'm not
there's
going to
no-
do it. I'm not going to do it, whatever that word, anonymously, because I want it tracked to the client, but I don't want to put in information on the client if we don't have a release to be entering that in. That's kind of where I'm struggling.
There should be nothing in the monitoring guide holding you to putting contacts into HMIS because it's just not built there yet. But it does say you have to keep track of your contacts. And then from those contacts, who did you enroll into PATH? That should be entered. That enrollment should be in HMIS.
And that's what we do for monitoring, right? So we look just that you've got some way of tracking the contacts. I think where it gets tricky is then we also look at what the contacts are in the PAR and whether or not they match the annual commitment. And I think if people are not manually updating that, that's when what they show in their PAR doesn't reflect the actual work that they're doing.
Right. So just so if I can just kind of translate what you just said, Lauren, just for anyone who's newer to this with us. So in the intended use plan, right, that's something that SAMHSA tells DEMIS they have to tell all of you to complete each year for the PATH application. In the intended use plan, you're saying we're going to have 100 contacts, and out of those 100, we're going to enroll 50 into PATH. And so what we're looking at when we monitor is when we pull that PATH annual report, we're seeing something along those lines of you've contacted about 100 people and you've enrolled about 50 into PATH. That's where we're comparing those numbers from what's in your annual report to what was in your intended use plan when we did the application. And it's okay if you're tracking those contacts in spreadsheets or, as Jen said, pieces of paper, as long as you have a system in place that you're taking all of that and you're manually putting that total number into your PATH annual report so it shows everything you did throughout the year for contacts. So I just want to make sure that that's clear.
Thanks, Brenda. Super helpful.
Yep.
Suzanne, do we have enough time to do this breakout or do we want to?
We are going to do it. We are going to do it.
Okay.
Just at
Great.
least for 7 minutes, because we've been talking a lot and I feel like it's really, let's give people a chance to talk to each other.
Yeah.
I've got it all set.
Great.
So Shannon, you're going to put the breakout cues in the box. So I've got you set up to make 3 small groups, and we'll give you about 7 minutes or so to talk with each other. And then we're going to speed through the rest so that we can, at least you know what's in the slides, but just give you guys a chance to talk with each other. So I'm opening the rooms and we'll give you a warning when we're about to close. You've got to actively pick a room. Join a room. So chat while you were. Welcome back, everyone. Welcome back. Welcome back. Hopefully it was good to have a couple minutes to talk with each other. Obviously, we have a lot of information to provide, and hope that that was useful for you guys to have a little connection time. Is there anything anybody really wants to share from those breakouts? Because in the interest of time, we're just going to move on. We normally would have debriefed this a little longer, but definitely want to give an opportunity if people want to share something that came up in the discussions. Okay. Did you at least like talking to each other? How about a thumbs up on that? Okay. Getting
Yeah,
a
I'll
couple thumbs
say
up on
really
that.
briefly, I actually really appreciated talking to both people I talked to and just kind of sharing similar experiences is kind of nice to know. It's not just me.
Good. Thanks, Jen, for sharing that. Hopefully some of you are making new connections and you'll connect outside of this session. And that's certainly one of our goals. And definitely at your outreach meetings and things. Okay, so I can't advance the slide, but Lauren, could you advance the slide? We move into, I know everyone's really been waiting for this, is an overview of the funding, the data, and the reporting. And we had a bunch of questions before around data, so we expect it, but do not be shy, even though I'm talking fast and we're rushing. It is about you getting what you need from the session. So please ask a question, put your hand up, shout out, don't wait. Don't leave here with a question that you didn't ask. So can you do the next slide, Lauren? So the funders for PATH, I think you guys probably know this, it's Substance Abuse and Mental Health Services Administration, which is a federal agency, part of the United States Department of Health and Human Services. And it is DEMAS, the Connecticut Department of Mental Health and Addiction Services. So the way it works is this, the Fed, SAMHSA gives every state an allocation annually, and then the state has to put together an intended use plan, which we're going to talk about in 2 slides, for how they're going to use those funds. And in addition, in Connecticut, Connecticut supplements the amount of funds that come from the feds, because it's not really very much. And the Department of Mental Health and Addiction Services subsidizes that. And you can see the requirements here. The big data requirements are really coming from the feds, from SAMHSA, who want you to use HMIS, who require those intended use plans. And then DEMAS is really coordinating all those efforts, making sure that everybody knows the rules and is doing some monitoring to make sure that there's adherence. DDAP, which is another data system, is the state's database and data system. So that's also required. I'm going to go to the next slide because we're going to talk about outreach plans later. The last time the PATH funds were rebid through a major procurement process was in 2015. And since then, except for the changes that Brenda mentioned earlier, where agencies were no longer, maintaining their contracts, things have been really pretty stable. They anticipate that in 2024, there will be another RFP. I think you'll hear a lot more about that long before it comes out. Next slide. So the intended use plan, is a federal requirement by SAMHSA. And this is part of what the state, so the feds say, here, state, here's your money, but tell us what you're going to do with it. And the intended use plans are what you submit to DEMAS so they can submit them to SAMHSA. Most recently, it was due in March. So if you're new and you joined after March, you have time till the next IUP is done. The current year for SAMHSA is September 21 to August 22. And in the intended use plan, you're providing your budget, you're providing your proposed services, contacts, and enrollments. It's very important, and I know this from, reading a lot of monitoring reports. I think there's a lot of interest in showing that we're going to contact a lot of people, we're going to enroll a lot of people, but you have limited staff, you have limited resources. So those targets can adjust and should adjust based on what's realistic for your program. And I know that our team has fielded questions on this. Please reach out if you have questions about your IUPs and those targets. I mean, it's done now for the year, so it's good to be thinking about it for next year. Next slide, Lauren. So we already talked about HMIS. You have to enter data into HMIS, and you need, in order to join HMIS, you have to go through training. Training that includes for you, but also any staff person who is, Lauren mentioned this in the onboarding process, that people should get access to HMIS and get training. We know that there's a little delay now in getting trainings. People have had to wait. We're hearing a little bit of complaints about that. So if you get new staff, make sure you sign up right away to get them into the HMIS training, because they cannot use HMIS under their name until they go through the training. And then there are some resources for HMIS. There's a quick guide. There's how do you run an APR, an annual performance report. There is the HMIS help desk, and then outreach program performance data. So there are resources to support you in that process. But I think the questions beforehand were very helpful. Next slide. Yeah, you were right, Lauren. I was just doing. All right. So this has already been mentioned. We've already thrown out these acronyms. Remember, I said it's going to be a lot of alphabet soup today. So PATH has an annual report that they call a PAR or a PAR, and then they have their own database that they call the data exchange, which is PDX, PATH Data Exchange, which is, Brenda, were we all together when you mentioned the new announcement that PATH, that the feds are redoing that? No, that was during the break. That SAMHSA is redoing that database. Yeah.
Yeah, so SAMHSA is looking to update PDX as a system, but they say they're going to do it by 10/1 for the next report. My gut says not to hold our breath, but as soon as I get more info, I will let you know.
Thank you.
Yep.
So DEMIS has a DDAP system, which is their data system, and the data has to be uploaded to DDAP. So there's a training, there's a reporting, there are progress reports. Again, these are links to resources for you. The annual report for the feds is generally around October, and that is an assembly of all the individual programs and what they've been doing that has to go into, pulls together all the data from all the programs into the PDX. You need to let DEMIS know who should have access to that reporting. Making sure that you're doing your quarterly reports helps with your annual report, of course. And then there's a link to some more resources as well as a help desk. But I think start by taking a look around that system and making sure you're familiar with it. Go to the next slide. Consumer surveys. So the PATH program does an annual consumer surveys. They were due 2 weeks ago. So hopefully you got the email. This goes to what Lauren was talking about earlier about having the people we're working with and serving, having a voice in their services. So this is a paper survey or a SurveyMonkey survey. There are multiple formats. What we do at Housing Innovations is we compile the data and develop reports for you and send every agency, and DEMIS gets a report on what the consumer surveys did. We're hopeful that you have, maybe you build this into your monthly team meetings or weekly team meetings, some way to take a look at those results and take actions based on what you're hearing, including, reveling in people being really happy with your services. I think it's always, consumers tend to give positive feedback no matter what. It's almost universal. And they also do point out things we can improve on, but hearing especially what's gone well, I think is really renewing for staff and for you guys as you do this really difficult work.
I just want to say something.
So I think we're going to have a report. Sorry, Laura, I was going to say, Lauren, are we going to have,
Go ahead.
We'll have reports back in June or so for people to see their consumer data?
Probably sooner than that. They should be in a few weeks, within a month, I would say, for sure. But I wanted to say really quickly, because there's been a little bit of confusion around this in the programs, that this is different than the usual DEMIS consumer surveys, right? So as PATH project, you are not required, and Brenda, you'll jump in if I say anything wrong, you're not required to do the regular DEMIS surveys for your PATH clients. You're required instead to do these surveys, and they're really geared more specifically. They don't ask a lot of questions that are on the DEMIS surveys that are not relevant for PATH participants.
Thank you, Lauren. That's a really important point. And I know some of you are DEMIS agencies or have lots of DEMIS grants, so you know about those other surveys. Brenda, did you want to?
Nope,
in
I'm
there?
good. I just don't know if anyone has questions. I know that did come up in a couple monitoring visits around surveys. Nope, I'm good.
Please don't be shy. If you have questions, put them in the chat. As I said, this is your time. Oh, can you advance the slide? I'm clicking my clicker and it's not working. So we're not gonna, we're not breaking out now, not that we plan to on this. This is, how are you, maybe we could just take a minute and hear, how are people using data or reviewing outcome data with their team? What data quality practices you're using to make sure staff are entering data? And if you love data, hit the thumbs up emoji. I know that's usually a small number of people. But if you do love data, I'm not seeing not one thumbs up emoji. Oh, there's one, Molly. Okay. Molly gave a thumbs up. All right. Well, I hear that not a lot of people love data. It is important to show the work we're doing, to understand the dynamics of homelessness, to see how our programs are going. Does anybody want to share how they review data? Oh, Brenda's hand is up. Great.
Yeah, I just wanted to say, just quickly, one checks in, because I know sometimes it's stressful at the end of the year when we're trying to get all of the data for the PATH annual report. Just so you know, in HMIS, there is the PATH annual report. Even if you run it throughout the year, it'll tell you what your data is going to look like at the end of the year. So just so you know, you don't have to wait until October to run that and start kind of freaking out. And maybe you had some staff turnover and are these numbers correct? And run it every week, run it every month. You know, it's just something to kind of be a checks and balance and just look and compare it to how many active clients do you have? And you could do the same with DDEP. Just run your client roster every couple of weeks and see, does our client roster look the same as what we actually have paper files on versus what we have in HMIS? And just throughout the year, just run those and just check up. So October will be open and shut. You could be done in a week.
Great tips, Brenda. Folks have questions about data or things that they found helpful in dealing with the data issues? I'm pausing to give you time. I know it's not everybody's favorite, and hopefully I think things have gotten more streamlined, and hopefully they'll continue, as Brenda said, to continue to build out these systems so that it's not quite so complicated. I just want to give a shout out, and as I always think back to my days as a case manager, and was lucky to work in an organization where they did share data with us on the front lines. And I think it really is helpful to staff to see those numbers, to see what's coming out, to look at those reports, to see how many contacts were made, to see how many people are enrolled, to see how many people got housing, see how many people got benefits. It really is helpful to staff. So that data is not secret. It's a great administrative item for your team meetings. So, you know, that may be where you do it. But definitely think about how to get that in front of staff, because a lot of times they're the people entering it. And if they don't see the meaning of the data and what the results are, it's hard to remember all these rules and requirements. But when they see the report and it shows we only have 5 people enrolled and their staff knows that they have 10 or 15 people enrolled or something like that, then that becomes more meaningful. So I'm just going to do that commercial. I did put my thumbs up because I do love data, but I also know you have a lot going on and it's tough. And the most important thing is for staff, I think, to really understand how important they are in telling the story of your outreach program and what you're doing. Okay, I think I'm at the end of that was super speedy. Now Lauren's going to talk about outreach plans. And remember, I just talked about the intended use plan. And remember, that's the federal requirement. Now we're talking about the outreach, and that's a local requirement. And with that, I'm giving the warm handoff to Lauren.
So I'll be quick. So the outreach plan really is the document. The intent of the outreach plan is to really try to coordinate across the CAN with everyone that's doing outreach in the CAN to make sure that it's a collaborative effort that you are, there are no gaps, right? You're covering all of the areas where unsheltered homeless people are most likely to be. If there are multiple teams, people aren't all going to the library on the same day, right? But we also understand that you guys are busy and that there's limited funding in these contracts and that you're not necessarily able within your cans to play that role. And so we are not, when we monitor, monitoring on the content of these plans. We are just monitoring to make sure that you have done a plan, that you've submitted it to Brenda and asked her to sign off, and that you've done the same with your can. So you guys really have to determine the extent to which it's feasible for you to use the plan as it was originally intended as a tool to coordinate across all of the providers in the can, which I think some of you are, or if that's not feasible for you, just to use it on your team to coordinate services among your PATH team specifically. So this is just the, a little screenshot. If you're not sure about what document I'm talking about, this is what the outreach plan looks like. There's a link here to the blank template that you can use. We recently, I think, made this a PDF, fillable PDF form. I think there have been some issues with that PDF document that we're working on working out. The Word document is still also available if you prefer that format, although the PDF looks nice. And then sometimes I think people are confused about what is supposed to be in each of the different sections on the plan. And so what we did is we created this sample. So if you're confused, you can look at that sample and that might help you understand what we're looking for in each section of the plan. And then of course, by all means, if you're still confused, call us and we'll help. And so I'm not going to go through this, but these are all of the different sections that are included in the plan. And really super important, right? We want to identify the clients that are most vulnerable in the can, so that we've got a plan for making sure that we are seeing those people as often as possible. Brenda has her hand up.
Yeah, I think you're going to get to the signatures and stuff. I just wanted to quickly, because we just did a round of these. These were due the end of March, so I appreciate everybody getting those together for me. So just so you know, as Lauren is saying, this is kind of meant to be a working document, right? And I think I noted that to some of you when I returned your signed outreach plan. So a perfect example to use in your supervision is to maybe look at this so that you're putting your eyes on this like every month. It doesn't mean you're in charge of wrangling all of the outreach in your can every single month to update the plan. That's the dream, right? That's what we hope will happen at some point when we can get fully functional, fully funded outreach teams in every can. But until then, just make sure you're putting your eyes on it. We're asking supervisors to sign it every month, so we know that you're using this to kind of guide the work that you're doing as the PATH outreach worker, and then sharing it with your can. And then again, twice a year, sending that to DEMAS. So we just did a round, and then we'll sign off on another round in September. So just to kind of be clear, don't just wait until the 6 months and then send it in. Make sure you're looking at it every month together and signing off. Yeah. Are there any questions around that? All right, thanks, Lauren.
Sure. So Brenda covered a lot of this already, right? So it's making the requirement is that your supervisor for your PATH program looks at the plan once a month and signs off, right? Updates it if necessary. Every 6 months, you go to your can, and hopefully you are able to have a conversation at least every 6 months with your can about who's doing what. If there's more than one outreach program in your can, which you all have more than one outreach program in your can now because of the DOH funding. Someone at the can signs it every 6 months, and then it goes to Brenda every 6 months for signature. And again, if you're confused about what we're looking for, take a look at that sample plan or call us, and we're happy to talk it through with you. As Brenda just said, the last plan version update of the plan was due to her on March 31st. The next one is going to be due on September 30th. We did do a training, a webinar just on the outreach plan when we initially launched it, and that recording and those slides are available. It may be something that's useful when you onboard new staff to just orient them to what the plan is all about. So are we going to do these breakout, Suzanne? We've got about 15 minutes left.
Yeah, no, and we have a few slides. Um,
I
I
think,
don't
I
know what-
think we're okay to skip it. I think it's something that we're working on in one of our Reaching Home working groups. So
Okay.
we could probably leave that work there.
Great.
But I think one thing we are seeing, and I'm going to just use that as an opportunity for commercial, and then I think I start to talk about monitoring, is that, you know, really having an engagement between your team and the CAN to really work together around how outreach is being conducted, that, you know, you guys are coordinating, that they're aware of your efforts. Again, really important because we really need the CANs to know what we're doing so we can get the folks you're identifying outside onto the by name list and through the CAN process if they need those resources. So hopefully your CAN is receptive. Every CAN is different in Connecticut, so that's much I know about these plans, and hopefully you can get some time on the agenda to coordinate with your CAN around what the plan is for outreach. And now next slide, and I'll jump to monitoring. Excuse me. And I think, you know, everybody gets monitored every year. It is a process that is required by SAMHSA, that programs are monitored. Housing Innovations conducts that monitoring. We are there to really, as working for DEMIS, to see that and support a common approach and common values, and people understand the practice goals and outcomes, making sure providers understand what the rules are and that they have a chance to ask questions one-on-one, and to identify where work needs to be done, where things could be improved, and also to generate training and technical assistance needs. And Lauren's mentioned, and you've seen many links to lots of different webinars and trainings that have been done. That's a lot of times coming out of what we're learning on the monitoring. And I think most of you see it as a support and see us as a support, and that's how it's meant to be, that we are there to support you and make sure that you know how to do what you're expected to do for the various funders. So I'm going to go to the next slide. The process, we look at some documents. It's all been remote since COVID, and sort of going forward, we're going to talk about the process some more once I guess we're kind of coming to a post-COVID world. But right now is looking at documentation and agency policies and charts in advance. We have an entrance and an exit conference with leadership and outreach staff. We'd like everybody to participate. We are looking at charts. We are talking to a staff person and a consumer. And then we write a report and get a sense of your organization. There's an opportunity to make sure the report is accurate and that we've captured findings correctly. There's recommendations, and your agency prepares a follow-up plan on kind of key issues identified in that process. I'm gonna, move us along. Thank you. These are the sections of the monitoring guide. There's a link to it. You can see the tool. And in the past, when we were in person, I just should mention this, we did go out on outreach with the team. So that was the difference between virtual and not virtual. It's really the only major difference. Okay, next slide. You should find, if you're new to your role, find your old report and see how you did and your follow-up plan. You can always negotiate, not always, I should say, but you should look at any kind of requirements in the standards that you can't meet, or things you need a waiver on because you can't meet that requirement. So you would go to DEMIS, contact Brenda and Molly, Brenda and or Molly at this point, I think it's both of them, to talk about any adjustments that you need. Also making sure that your enrollment and contact targets, already mentioned this, are feasible. And if not, think about the next year when you submit the IUP to SAMHSA, which is done usually in March, about changing those numbers. And then looking at whether you can provide, given how much staff you have, whether you can provide full case management to everybody, or if you target a subset. And that, again, is something that you can do. Moving on. Next slide. Thanks. So it's a webinar on everything you ever wanted to know about monitoring. So if you're going to get monitored or you're wondering what it's about, you can look at that. And next slide. Okay. I think we're about to, well, I can't believe it, getting towards the end. We want to do a Zoom poll. So this is, I see a lot has happened in the chat while I was yakking away. I think that's, oh yeah, okay.
think it's also
Shannon's put
Shannon
up
Radcliffe.
so many resources, but Lauren misses going on outreach with the team. So we are actually talking about, once we are in a post-pandemic world, how to make that happen, because it is really a critical piece of understanding the great work that you guys are doing. Okay, so I'm going to launch a poll. Our polls are all anonymous, but we'd like to know what you're going to do as a follow-up after this training. And you can pick the three most important items. I mean, we can't really limit you. So, you know, it's up to you, but what do you think is most important that you do is follow up after today's meeting? Reviewing your outreach plan and or your intended use plan, requesting waivers from DEMIS for some standards. We didn't go a lot into standards, so that may need some follow-up, providing additional supervision to staff, advocate for resources for my team, review content from today with my team, follow up on HMIS data, review the new manual, bring more tenancy, housing location resources to the table, increase consumer input, or how we, you know, incorporate consumer input or other. And so you can limit it to 10 choices in Zoom. So that's how many choices you have, but you can add things into the chat box that you are going to do that are your own ideas that we didn't, you know, include in this list. So I'm seeing about 4 people have responded. I think we have 1, 2, 3, 4, 5, 6, 7, and then 1 person is driving. So I definitely don't expect anybody who's driving to answer. I think we've got almost everybody. We've got 6 respondents. So I'm going to end the poll and share the results. Okay, so you can see that the big follow-up item was providing additional support and supervision to your staff, which is really, you know, of course, wonderful. They, you know, it's a tough work, tough job, and they need your help. And hopefully some of the tools that we've shared with you today will be helpful. I know there's a lot, and hopefully you don't feel overwhelmed, but you feel supported by it. And again, as Lauren has said numerous times, if you need our support to wade through any of this, just please reach out. But other popular items were going over the content from the team today and following up on HMIS data entry, which all great things. So what I always feel like is just identifying at least one thing to follow up after the training, so it doesn't, you know, kind of fall off into the never land. I think I have one more slide, Lauren. We're going to just have some closing comments. Oh, Brenda. Yep.
Sorry.
No,
So I
no apologies, Dee.
I just wanted to do a quick plug because I did see one of the things on there that had a lot of people voting for was just around resources and just kind of seeing what resources were in their area. And I just wanted to make a quick plug for the new block grant funding that DEMIS allocated to having one trained source specialist kind of line up with each of you as path providers. So hopefully you guys are using those new staff. I think most of you are overseeing both SOAR and PATH, I think. So hopefully those are kind of working hand in hand, and we can see again, one of the outcomes from the beginning of the presentation was around increasing income, whether it's through SSI or employment. But hopefully you guys are using that new resource. We really need to show our legislature that this works. We have about 3 years of this funding, and I'm really hoping to show some results that when we have fully funded source specialists really dedicated to doing those SSI, SSDI applications, it's worth the funding. And hopefully we can sell it and show that it works and keep the money going. But any questions around that? Hopefully you guys are all connected to your source specialists.
Yes, thumbs up, people. You know who your SOAR people are. Okay, real
See,
thumbs.
you
We'll do
ask
real
and you
thumbs.
shall receive. We've been trying to get funding for that for quite some time. So hopefully we can show that that works.
Well, and I just will say, because I do look at the outcomes, that actually the SSI and SSDI outcomes are pretty good on some of your teams, even pre-source. So hopefully this will, you know, help people who need additional support or take you to the next level. I'm not going to read this quote, but I think everybody knows this, that a boss and a leader are not the same thing. And it's really about creating a common vision with your staff and providing support to them. If you go to the next slide, I think we've really acknowledged, hopefully numerous times, that this work is really difficult, that your role as supervisors, managers, whatever you call yourself, directors, is really critical. Without your role, it's, often many teams have only one worker, I know, some have two, but it's really important to have that. Staff, we're often hiring, as was shared, somebody right out of school or somebody who maybe has experience but not in outreach. And so staff really do need that training and support, and money. There's nothing about money, but if we can give them more money, it's always a good thing. But especially since these are not high-paying jobs, supervision is really an important part to help people develop professionally and feel a sense of competence. And, we know from the research that good supervision helps us focus on outcomes, improve our programs, improve coordination, build our teams so that they're motivated, they have some fun. It does decrease staff turnover, and help people. Growing and learning is a real benefit for a lot of people. So I think we want to close by saying, we know your time is valuable. We know you have too much to do, but we know you are so essential to really making outreach work. We see the difference in teams where they have supervision. We know, and also you all should get supervision too. So, hopefully you are getting support in doing your roles and agency resources, but we appreciate everything you do. I know Demas does. And again, really thank you for your leadership to help people who are unsheltered in Connecticut to move into housing and have a better life. So we are 3 minutes before the end, at least according to my clock. I think Lauren's going to run us through some additional resources.
Yeah. So these are the community of practice meetings that Andrea White on our team has been leading with you guys. I think everyone's probably familiar with that opportunity. If you're not, let Shannon and I know and we will connect you up. These are the Demas, the great meetings that Demas does once a quarter, not just with you guys, but with all of the outreach workers. So you want to make sure when you have new staff that are coming on board that they know about those meetings, they've got them in their calendars and they're attending. The next meeting is here on the slide, as is the link to that meeting. You want to make sure that when you have new staff come on, you let Brenda know that and give her their contact information, because that's how she keeps people informed about these meetings. And then she shares contact information with us. And that's how all the emails that we send out, you make sure that everyone on your team gets. Outreach training resources. So these are just a whole bunch of different webinars that we have done over the past several years. Recently we did Andrea on our team did a training on how to use the modified mini screen to document serious mental illness, which is an eligibility requirement for the PATH program. And all of these resources are at this link on the top of the slide. I won't go through what all of them are. These I mentioned earlier, some of the COVID outreach training that we did early in the pandemic are on our website. So different content that we covered at that time listed here. Talked about this, super important, right? Your staff are working in some really tough situations. And so making sure that people have some training on how to de-escalate. And there's some resources here for that. And I think that's it.
Lauren, while you were talking, Molly put a resource in the chat box, came in between a lot of other resources about security deposit and utility arrear funding, which can often be a barrier, is utility arrears for people getting a new place.
Yes, that's also, thank you, Molly, for dropping that in the chat. So that's also a resource we're using the COVID block grant funding for. So definitely please access that. If you have questions, you can email Molly or myself after. If there's no questions, I just want to take the last 30 seconds and just thank you all for your time. I think I also want to thank Housing Innovation. So You all may not know that Housing Innovations is a contractor as well for PATH with Demas. They do a lot of other things around the state, but we give them a contract as well. And again, it's the same tiny little allocation of PATH funding that comes into Connecticut that we split out between Housing Innovations to really take the lead on monitoring and doing these webinars and trainings and case conferencing with all of you. So I just want to shout out to Housing Innovations. Thank you for your time. I think this was so helpful. I hope all of you found this helpful. And again, now it's recorded, right? So as you have new staff coming on, please build this into your onboarding. That was the whole point. Watch it every year if you need to just refresh yourself on all of the different requirements, whether it's from SAMHSA or DEMIS. And I just thank you so much for your time and your hard work. You're just doing such a great job out there.
It was great to see everyone.
Yes, thank you, Brenda.